Most runners think heel pain comes from tight feet or wearing the wrong shoes, but after nearly 10 years as a physical therapist and run coach, I found that the real cause is usually weak calves or foot intrinsic muscles versus just having some tight tissue and too much running too soon, either too much mileage, volume, or going too fast on the speed workouts. In this video, I'm going to show you exact exercises I use to help runners relieve heel pain and get back to running pain free. So, why runners get heel pain? See, plantar fasciitis, right, as you can see here, boom, is one of the most common running injuries, often triggered by sudden increases in mileage. Typically, when folks are training for like a marathon, but it can also happen for a half marathon and the shorter distances. Right. Typically, it's when you increase your mileage by more than like 10% increase in than the mileage you had in the past 30 days, right? Like a big jump. And it happens even more when it's like, obviously even a bigger increase, like if you're going 20% or even a 30%, especially if it's more than a 30% increase, you're pretty much asking for like a overload or an overuse injury because it's a really high jump from where you're at there, right? So like if you're just, your longest run was a 10 mile and then the next week you do a 20-mile long run, like that's a ridiculous jump. But sometimes it's not even that extreme. Sometimes in beginners it could be like, oh, going from a 6 miles, and then they jump up to like 10 miles or something, right? It's not always a big, like that extreme gap that I just shared. Right. The other cause could be weak muscles, right? So the weak muscles of the foot. See, a lot of people don't realize that there's a lot of muscles that make up the foot. You can see here in the figure in the image that make up the foot. Those muscles could cause heel pain, but also the muscles of the lower leg, the calf. So if you got pain in the back of the heel, sometimes it's actually can actually be a type of Achilles tendonitis or Achilles tendinopathy, where the Achilles, when the calf muscle and the Achilles causes pain in the back of the heel. Now, if it's in the bottom of the heel, then it's usually the muscles of the bottom of the heel. But regardless, these weak muscles are not able to handle the impact load of running. A lot of people don't realize that running is a high impact sport, 2 to 3 times your body weight every time your foot hits the ground. So even if you're just like a 150-pound runner, that's 300 to 450 pounds every time your foot hits the ground. That could be overloading those tissues as, again, your foot is hitting the ground. And then that could cause an overload issue where it just flares up the tissue. It's not strong enough to handle it. And then obviously it gets worse when you go in for the longer mileages or when you're training for the bigger distances. So the other causes could be limited ankle mobility. Sometimes people have limited ankle dorsiflexion or even eversion, different mobility in the ankle, right? And or tight calves. That could also increase strain on the heel because it's a regional interdependence. Even though your calves might be tight, but like, oh, why do I feel in the heel? The office says because then the tight calf can then affect the muscles at the bottom of the heel as well, and that could cause more strain or stress. And many runners only stretch the foot. And also when they stretch, it's a very short dosage, but never strengthen the muscles that support it, right? They think, oh, I just do a 15-second stretch or a 30-second stretch and then go out for my run. So, but heel pain can also be influenced by your foot posture if you have high arches, but also if you have excessive flat feet, right? Your feet are, the arch is completely collapsed or dropped. A sedentary lifestyle, let's say you sit all day for work or you stand all day, but you're not that active. Like maybe you're a weekend warrior, you like to run on the weekends, or maybe you run a few times during the week, but overall you're pretty sedentary. That can be a risk factor. And then also being overweight. Even if you're just like 10 pounds overweight, that could be every pound that you're overweight is multiplied by a factor of 4. So even just being 10 pounds overweight, when you go for a run, that becomes like 40 pounds of increased impact forces going through your tissues, your joints. So just being even just slightly overweight can also put you at risk for overuse injuries. And sometimes it's referred pain from the lower back. About 29% of the cases where you feel this heel pain is actually coming from the lower back, right? Especially if you notice that it changes to a different positions, like if you're sitting too long and then all of a sudden the heel pain flares up, like, oh, that might be a cue that it's coming from the lower back. And if you want a copy of this guide, I'm sharing it inside my free online run group, link in the description. So what actually fixes the heel pain? Well, step one, make sure it actually truly is heel pain and it's not, some referred pain, some other cause. When you have to reduce the irritation, temporarily reduce your running volume, cut the mileage by like 50%. And avoid back-to-back run days, right? So don't run every single day of the week. Sometimes people run like 6 days a week. Tell them, especially if you're injury prone or if you're actively dealing with pain, cut that out, right? Reduce it. Go down to like just 3 runs per week. And sometimes if it's really bad, you can't even do a run walk. Like let's say you tried run walk, but you're still having severe pain. You're limping. You can't complete a run walk program like run 1 minute, walk 2 minutes. For like 15 or 20 minutes, and you can't even do that type of workout, then you may have to take a few weeks off with no running whatsoever until the tissue relaxes. It doesn't have to be that long. Oftentimes, it's the inflammation or the acute pain releases, then you can start building, adding back in the run walk method. But you have to be smart about it. Don't jump into like 6 days a week of training if you're actively dealing with injury. And for even long term health, I still recommend just 3 runs per week. You can even do that for a marathon. So step 2, increase soft tissue mobility. You could roll a tennis ball, lacrosse ball. A lot of people have heard of this technique, and if you haven't, you simply put the ball under your foot, roll it back and forth. But do it for enough time. Don't just do it for 30 seconds. Do it for 2 minutes. Do it for 3 minutes. If both sides are having pain or some tightness, do both sides, because sometimes tightness is the warning light that it's going to become pain. So, do the tight areas of your foot, especially if you find a hot spot, press into it. Also do your calves. Oftentimes those calf muscles can cause tension that wraps into the heel. So do both your foot and your calf, right? Your gastroc soleus is seen in the image. Step 3, you want to stretch. I'm not saying that stretching doesn't work. The problem is you have to do enough of stretches. It's not one 30-second stretch. It's usually 3 by 30 seconds, so 90 seconds minimum, sometimes even 3 minutes. Or sometimes we'll spend 3 minutes stretching the area, but if I'm more limited time, we'll do 90 seconds, right? 3 by 30 seconds, right? You got the plantar fascia stretch, which is the foot on the wall. You got traditional calf stretch with the knee straight. If you bend the knee, it's the soleus. You can do this type of stretching daily. You could do it after your runs as like a passive cool down. You could do it dynamically if you do a dynamic type of stretch where you kind of oscillate or go back and forth into the stretch is more dynamic, part of an active dynamic warm up. That's fun too. You could do as a dynamic calf stretch, a dynamic plantar fascia stretch as part of your warm up for your run workout as well. And then you want to strengthen the calf and foot. So strengthening should be done about 3 times a week, especially if it's a weak area. Now, if it's stronger and you're progressing, you could cut down to 2 times. But while you're actively trying to strengthen, you should actually do it 3 times a week. Yes, if you're very busy, you could get 2 times, but 3 times is even better, especially if it's a really weak area. And then you need to focus on, this case would be the calf and the plantar fascia. All right, so you could do calf raises on a flat surface if it's more back of the heel. Now, if the pain is more in the bottom of the heel, the bottom of the foot, you could do this elevated heel raise. It's actually a plantar fascia heel raise where you put a rolled up towel under the toes. You can see in the image here, the knuckles of the toes. You do an elevated calf raise where it really causes you to roll into like the toe extension there, and that's going to further load the the muscles of the bottom of the foot, which is going to go a long way to strengthening them. Now, if it's very painful, you could regress it back. Just do an isometric hold. Maybe you just hold it for like 5 seconds, 30-second hold, a minute hold. And then once the isometrics become easy, you could do the dynamic going up and down the concentric eccentric phase. And then you could start adding some load. You could put on a weighted backpack. You could hold dumbbells in your hand, kettlebells, even put a barbell on your back as you get even more advanced. And then eventually, once the strength phase is pretty easy, you could then progress to plyometrics, doing like pogo hops, jumps, different jump variations to allow the tissues to get used to rebounding. Because essentially, running is a series of single leg jumps. So you want to condition your legs to handle the demands of running, which essentially they'll see a series of single leg jumps. So by doing this type of exercise progression, this is a great way. This is oftentimes how I help rehab a lot of folks who are dealing with heel pain or plantar fasciitis pain. But the trick is finding out, where you are along the sequence and which is along the continuum, which is the right exercise for you to do. Because if you do the wrong exercise, you flare yourself up. Doing the right exercise will help you progress. And sometimes you do it, the exercise is too easy and there's no effect happening. It's not enough of a stimulus, and then you stay stuck at the same level for months and months, and you're also not progressing. You have to understand how to properly progress it. So then you gradually reload to running, right? So once you're able to jump and it's pretty easy, you're able to do strength stuff pretty easy, you do some short, easy runs. I like doing run walk, but if run walk is very easy and you're able to tolerate, it doesn't cause you any issues, you go on run to like very easy jogging, right? Easy pace running, easy pace for you conversational. Stick again to just 3 runs per week. Use the pain traffic light system, right? 0 to 3 is a green. It's a green light. That means you go, continue with your workout. You could slowly increase it, right? So if you cut the volume by 50%, you could start slowly increase the mileage. Let's say you're running 30 miles a week and you cut it down to 15 miles a week. Again, you can slowly start ramping up the weekly mileage week by week if you're still in the green light zone. Now, if it's a yellow light, right, that maybe it flares up doing a long run or something, that means you have to modify that workout, make note of it, stay at the same step. And if it's a red light that's causing you to limp, right, it's a 7 out of 10 pain, it's really severe, then you have to maybe stop altogether, take a few weeks to rest from running if the pain really flares up at that point. And obviously, if you're dealing active with pain, you should be working with a professional, someone who understands how to help work with runners, like a sports physical therapist. And we'll talk about a little bit more. So what happens when runners do this, right? Heel pain often improves within 2 to 4 weeks, right? At least acute pain. And if you continue to strengthen your calf and foot, the strengthening will occur over 6 to 8 weeks. And then eventually by like 8 to 12, you're typically able to go back to normal running or so. Maybe you'll have to start with easy runs, but eventually you'll be able to progress past like that 12-week mark or so. And if you want to train for a marathon, right, you can then start going to a marathon training block. Right, running becomes less painful. It becomes more comfortable. It'll be obvious signs that you're feeling better. You'll feel the ability to tolerate the longer run when you know that it's actually working for you. Like, hey, you could go for a long run. You don't even feel it. It feels great. You feel the spring, the step back in your step. And then you also, by keeping up with this kind of routine, you also don't want to stop it when you get there. You continue this kind of maintenance routine. You help prevent the recurrence of plantar fasciitis or heel pain, and you help prevent it significantly. Now, there's always a chance it might creep up, but if you keep up with those exercises we talked about earlier, you oftentimes can help prevent it from happening as well. So if you want help fixing heel pain, right, maybe you're stuck, you try to do it on your own. I also have a couple spots open for private one-to-one coaching. Click the link in the description to join. First come, first serve. So conclusion, heel pain isn't just a foot problem. For runners, it's usually a load management and strength problem. If you improve your calf strength, restore ankle mobility, and gradually rebuild your mileage, most runners can get back to running pain-free.